DiBenedetto with Big Life Thing here. I'm back talking to Dr. Lisa May, a board-certified dermatologist and owner of Billmore Dermatology. We have just spent about an hour talking about female hair loss. So one of the things that people have always felt is that the hair loss gene is passed down through the matriarch. Now, does research still support that, or the new research indicates it doesn't matter anymore, both genes?
So there are lots of genes involved. So it's not one simple, like blue eyes, that middle school genetics, unfortunately, that we can just do that. But that's a really important question that someone will be asked in their appointment as well. So asking family members, we care about everyone in the family. So finding out, and like you said, your grandmother wore a wig. My grandmother had her hair done once a week, teased up so that it would stay for a week and look like she had a full head of hair, even though she really didn't have any. With my grandmother, I can say, well, she had thin hair. You may not have even known. And so asking family members, well, when did you experience hair loss? We do know that when family members experience hair loss, and that can be men, women, at a younger age, then their children, their siblings are more likely to experience thinning at a younger age as well. So we do know that that plays a role. And it's all family members. So asking siblings, and we hear all sorts of things. So just because everyone in the family has a normal head of hair and grandma still had thick, lush hair when she was in her 80s, doesn't necessarily protect you from the typical, what we call androgenic alopecia, the female pattern or male pattern hair loss or baldness.
I see that behind the chair a lot because I ask these questions trying to get a familial history from my clients. And a lot of times I hear that neither of the parent had any hair loss and they had very, very thick hair. That also goes into this disbelief that this can't be happening to me, that certainly it must be something else beyond female pattern hair loss. You know, one thing that has always just rattled me, more so in the past, is constantly being diagnosed by the general public. So, you know, you speak a little bit to the questions you ask, like your diet, your stress level. You know, when my hair started to visibly thin, people that hardly knew me were just like, are you taking your vitamins? Are you taking care of yourself? And that used to drive me crazy because I was constantly getting diagnosed with people. And then I would be very vulnerable and open about my hair loss to people. So after I would tell some women, well, no, I have female hair loss in my family and I'm actually losing my hair. I have very, very thinning hair. I have tried everything, but no, I'm losing my hair. They still didn't want to accept that. They would still ask me like, oh, well, a friend of mine is taking hair, skin, and nails and is getting great results with that. So there is, I think, which is why I think it's really important to see a dermatologist, somebody like you, not just being diagnosed out there willy-nilly by your aunt and your friends or your mother's friends or your clients or whatnot. It's really important to go to the dermatologist.
And not everyone's hair loss, just as you alluded to, not everyone's hair loss is the same type. Lots of different types, and people can have more than one type of hair loss. So someone can have gradual thinning, but on top of it, go on a restrictive diet, lose 15 pounds over the course of 2 months, and then have what we call a telogen effluvium, where they lose lots of hair on top of that. So it looks like the female pattern hair loss is accelerating, when in actuality it's another process on top of it. That can then regrow and get back to that steady state. And so it's very hard to compare what a friend did responding to a certain product because we don't know what was really going on. Maybe they did have a different type of hair loss. So we ask all of those questions. The next step is, once we've taken a very thorough history, we examine the scalp and the hair. And oftentimes It's examining the nails, it's examining hair on all parts of the body. So some people can just lose hair on the top of their head, but some people can lose hair all over. So we'll look everywhere. We'll take a clump of hair and we will pull. And that's called a hair pull test. And we will
Nobody
see.
likes that.
It doesn't hurt.
Nobody wants any more hair taken out of their head.
So it's very simple. It's just grabbing
Just a little
and
bit.
pulling and seeing if anything comes out.
Yeah.
And then oftentimes we'll look at that hair under the microscope so we can tell what kind of hair it is. And we've talked a lot about this, but hairs can be in 3 different phases. And so we look at what phase that hair is that's pulled out. We also look, and oftentimes with magnification, actually at the scalp, and look to see what do the hairs that are left look like. Do we see miniature hairs? Because in male pattern baldness or female pattern hair loss, the hairs don't actually disappear, they shrink. So they become fine, teeny tiny little hairs, and we look for those. We look for loss of the hair follicle. Did a process destroy the hair follicle? That's called scarring. We can't reverse that. So we look for all of those. We look for skin diseases, for ringworm, for psoriasis, for eczema. And ringworm can make people lose hair. Psoriasis and eczema may not, but if the scale gets so thick, the hair clumps in there, and then when the scale falls out, it pulls those hairs.
What about seborrheic dermatitis? That is something we are often asked about. And sometimes we hairdressers talk a little bit about a smell, that maybe we can identify that goes along with it. Because a lot of people think that might be their issue. So can you talk a little bit about that?
Seborrheic dermatitis is what people refer to as seborrhea, dandruff. It causes some redness on the scalp, typically an oily, waxy scale. And when you rub your hands on your scalp or comb, you may see flakes that come off, the typical old Head and Shoulders commercial. That does not cause hair loss. That is a very superficial scalp problem, so it's just on the top layer of the skin. It does not affect the hair follicles.
That's good to know.
But it is super common. So oftentimes you'll see those 2 things hand in hand, hair loss and seborrheic dermatitis. But treating the seborrheic dermatitis, unless someone has a really, really thick scale, like large scale, where the hair just gets embedded, it's not going to make the hairs fall out.
And it won't clog the follicles?
It may cluster around hair follicles, but it doesn't prevent that hair from continuing to grow.
That's great.
Yeah. Now, ringworm, on the other hand, which can look very similar, can actually destroy the hairs. So the ringworm can actually invade the hair shaft, the piece of hair, and cause that to break off. So we don't see a lot of that in the United States right now, but it's still out there. Seborrheic dermatitis is much more common.
Well, I think we're on the same page. I appreciate you so much coming in and talking to us today about female hair loss and thinning hair, which relates to so many people. You will see Lisa again as we continue our series and our discussions, and I think that's our